Seizures have changed tremendously since he's had the VNS. He used to have up to 14 a day. Now he has gone and had one every 18 days, which is wonderful.
About a year after being implanted, having had used the magnet twice to interrupt seizures, the epileptologist thought it was time to start reducing medications. And so the seizures were becoming less and less. And probably 3 years after being implanted, I started coming to the point to where I didn't think of myself as being a person with epilepsy.
When a patient is implanted, they may not see the total effect at the time of implantation. After the months go by, the seizures may get less severe, less frequent, and months later, they will continue to see the benefit of the implant.
A unique benefit of VNS therapy is the ability to control stimulation with the use of a special magnet. The magnet can activate the device to deliver an immediate extra dose of stimulation, which can potentially stop a seizure or decrease its intensity. The magnet is also used to control side effects of the stimulation on an as-needed basis. However, use of the magnet is not required to be successfully treated with VNS therapy.
I feel empowered by the magnet, and I'm more relaxed that I know I have a tool or device in helping him recover from his seizures.
We also have one that the school keeps for him also, and had trained them to use it so that they're aware of it too, and they've used it a few times.
I use the magnet whenever I'm having a seizure or whenever I feel like I'm about to have a seizure, and it really makes you feel like you're empowered, like you can do something. I think one of the hardest things about having a seizure is you feel like you're helpless.
I use the magnet for two purposes. First of all is when teaching a class or when preaching, I use the magnet to shut the unit off. But I've also used the magnet to interrupt seizures. It's vital to have it with me, either on my belt when I'm in dress clothes, or in athletic clothes I have it strapped to the wrist.
In addition to improved seizure control, patients also experience many quality of life benefits from VNS therapy.
In terms of medical therapy, it can be very difficult to take your medication exactly on time and never forget to take a dose. Patients have a lot of difficulty with that. We call that compliance, but really it's a host of factors that just interferes with people's ability on a day in and day out basis to always remember to take their medication. With vagus nerve stimulation therapy, that problem is completely eliminated because the device is programmed in the doctor's office and will continue to do what it's set to do until the settings are changed.
Patients after the implantation of VNS may start feeling a sense of alertness that they didn't have before. Mood can be better, and also if we can decrease the medications, the patients may feel better.
Since the VNS therapy, I'm definitely more alert. My memory's always been a little bit bad, but I do have better recollection of things. And I'm also I'm a happier person because there's not as much to worry about.
My quality of life before VNS therapy was very, very low. I really didn't have any life outside of sleeping and taking medicine and trying to deal with seizures. My quality of life after VNS therapy is incredible. I was able to graduate from high school, go to college, get a job. I'm now engaged, about to get married, and have a house, and it's completely different, and it's a blessing.
Unlike medications, most patients choose to continue treatment with VNS therapy long term. Approximately 70% of patients opt to have an additional procedure to replace the generator when the battery runs out.
VNS therapy has changed the way we look at therapy for epilepsy because patients do come back to say, I want to be reimplanted. The retention rate is very high. Patients want to come back to be reimplanted because they see the benefit. Even if the patient is not seizure-free, The severity of seizures may be better, the after-seizure effect may be better, and the way they can handle the medications may be better than before VNS therapy.
When it was time to either have it taken out or put a new one in, there was no question. I definitely wanted it again.
Looking at all the benefits and how VNS has changed my life, I would have been implanted at age 15 rather than 17. It's given me a lot more freedom. It's improved my quality of life.
I wish we had known about the VNS a lot sooner, earlier in his years, because I think it would have made a bigger impact on his life than it already has.
Now that I've been implanted with and experiencing the VNS therapy, I'm just hoping that I can just keep as active as I am, continue to work in interim ministry, and I'm planning the next big ride because I'm addicted to cycling, and I want to just keep doing it. I want to be one of the people that when they're 95 or 100, they're writing the stories about how they stayed active.
Well, a typical day now that he has the VNS is he's more outgoing, more fun to be, more fun to be with. He enjoys things we do as a family, and we can go more places like the park. We have very enjoyable times as a family.
Things I can do now that I couldn't do before VNS therapy, some of them are just simple things like stay awake all day or be able to read a book without falling asleep, or be in charge of little children, taking care of them, looking out for them.
You can live life. My best advice would be to get a VNS because it helps you live life without having to worry about so many things.
VNS therapy is approved for use as an adjunctive therapy in reducing the frequency of seizures in adults and adolescents over 12 years of age, with partial onset seizures that are refractory to anti-epileptic medications. To find out more about VNS therapy, please call 1-888-VNS-STEM. That's 1-888-867-7846. Or visit www.vnstherapy.com.